Hi, it's me again, Maureen Bautista, and I just want to thank you, Dr. Contessa, for giving me a chance to have probably 10 years younger look. I've just had my liquid powder threads, and I think it worked because I used to have hollowed eyes on this area. I have a lot of a bit of what do you call this? Yeah, hollow. No, it's already darkening on this side. That's why I have to really probably do something about it. So thank you for that product. I think it's the first. I have this, of course, particular concern with my nose, a bit swelly here, although I don't really have a flat nose. But of course, who wouldn't want to have nose that are really sticking out and beautiful on a woman's face? But of course, I have this hesitation of who will do my what do you call this, nose lifting. So what I do, because of course I do makeup on other people. I'm a makeup artist and a hairstylist. So when I do nose line, I see the difference when it comes to photography, videography, their enhanced features. So every day what I do, I put a little bit of nose line so as to lessen the what do you call this, the fats on my nose. So it has to be not really slick thin, but then a bit narrower. Okay, this time I think Dr. Contessa will do something about it. And I also want to thank her for giving me the chance also to have a taste of what she has, the modern way and the right way, you know, because mostly, you know, we have to do this the professional way. I know there are a lot of people who are doing this, but they're not in the right position, probably the licensed ones. So I hope you guys are aware of it. So maybe you can go and contact CSA Medical Aesthetics, so you can just inquire about what you needed for your face. Please don't forget to subscribe and click the notification bell. See you guys!
Good day, everyone. Welcome to the CSA Medical Aesthetics. I'm Dr. Contessa, your certified aesthetic physician. In today's episode, we have a follow-up for Miss Maureen Bautista. Welcome back, Mau.
Yay!
Yeah.
Hello, everyone.
So in the past, we did this correction of the static glabellar lines. Also, we did ultracold treatment for the under eye. And now, to complete the periorbital rejuvenation, let's do a so-called non-surgical nose thread lift. Okay. Yeah. And we'll have a new treatment. Actually, we just will introduce it in our clinic, the so-called Rejuran for ageless skin. So we have a new treatment right now that will improve the skin quality, the skin condition, the skin tone, and the skin texture. Actually, according to like more than 170 human cultures, in terms of the attractiveness or beauty, the number one or the most attractive area of our face, actually, the condition of the skin, the quality of the skin tone, the skin texture. Yun daw yung most attractive. So the skin tone and the skin texture, actually, it was reported to influence our perception of attractiveness. Having homogeneous skin, smooth skin, clear skin, blemish-free skin, acne-free skin, wrinkle-free skin, that's the most attractive. That's why right now, you can hear a lot of like skin booster treatments. So, social media, okay? You've been seeing a lot of that, like this, improving the skin tone, the pores, the like targeting oiliness, targeting those blemishes, dark spots, age spots, all those unwanted anything you see on the face that's not so attractive or will make you less or not really beautiful, okay? So, skin boosters, like for example, what we have right now is Rejuran. I don't know if you've been hearing a lot of this, like exosomes, micro skin nutrients, and then they even have a micro delivery of these nutrients in the dermis. I'm pretty sure you've been hearing a lot of those, okay? So, for Miss Ma, we wanted to complete the rejuvenation apart from treating the eye area. Of course, it's the entire face. All right?
Exciting.
Yeah, I think she's thinking about or in my mind, she's concerned about the nose area because, of course, we don't want to alter our look. We still want to be the same as. Yeah, we just wanted some enhancement. And it's just like when you're doing your makeup, right? You're into makeup, the nose line. Because I'm also like deceived by some pictures of those who have this kind of high nose. Yeah. When after they've done their makeup, they look like they have sharp nose or high nose, elevated nose, but then
thin nose
and thin nose. Okay, but when you remove the makeup, it's flat,
wide. That's why
flat,
that's mine.
wide and short. So in non-surgical procedure, we can achieve that so-called nose line makeup effect. Okay, that's just the goal. That is just the goal. Not really like, you know, making it like a different Maureen. Okay? So, what kind of procedure and what will be our technique for the Rejuran, we'll show you when CSA Medical Aesthetics return.
Stay tuned.
And we are back. So, we'll be doing procedures for Maureen. First one, the non-surgical nose enhancement. And the second one will be the Rejuran treatment. Okay, so we'll start with the nose. Okay, I'll anesthetize the entry point. Entry point is at the so-called infratip. It's like around 5 millimeter inferior to your tip defining point. Okay, then for this area, you can make a puncture. So, puncture the entry point. Okay. And then you can use like your lidocaine in your syringe. Then I have a cannula here. You can actually create like a tunnel for your threads, okay? So I'll push the lidocaine here in the layer 4 of the anatomical structural layer of the nose and then pushing that. So this is lidocaine with epi. Then actually, you can also make a tumescent solution here. So your tumescent also has the NSS and sodium bicarbonate. And I'm just going to be injecting into this columella space here. So that is the numbing area. So after anesthetize, you can now start with your PDO nose threads. So I have here a gauge 19 cannula, okay, with a PDO. So the cannula is 50 millimeter length, okay, and then we're just gonna glide it in that space in between your layer 4 and layer 5. So you want to be on top of the bone and cartilage, okay. So for Ma, we'll just be using minimal number of threads because she wanted to have that very natural, subtle look. Okay, out. So it's just inserting this PDO threads in that anatomical tissue layer up to the radix. So again, we follow certain measurements. We have ratios, proportions, angles. Okay, so after the bridge augmentation, we'll proceed with tip columella projection. So there you go. We'll now do the tip columella projection. So actually, I noticed with Maureen, her nose has this a rounded tip, okay? So Asians have round tip nose. Okay, so somehow we wanted to make it less round, right, Mao? The tissue layers in our nose, we have 5 layers. We have like the skin, superficial fat, then we have fibromuscular, and we also have the so-called deep fat layer, and then the bone and the cartilage. So we're actually done with the bridge and the tip columella projection. So the next thing that I will be doing, so later we'll show that to Ma'am Mao, is using the so-called Rejuran. Okay, so what is Rejuran? So actually Rejuran is one of those skin booster treatments, okay? And they're used for anti-aging treatment right now. And they're made up of the so-called polynucleotide. Polynucleotide is a so-called a DNA fragment, okay? So these kinds of molecule, actually they have certain molecular sizes. We deliver them in the dermis. Your dermis layer has all this extracellular tissue matrix, your collagen, elastin, glycosaminoglycans. So you just want to restore the production of your tissue matrix. So you want to build up, you want to like have those fibrous tissue proteins be regenerated. So our treatment is already the so-called regenerative medicine right now. So I have a Rejuran here in this syringe here. It's 2 ml of a Rejuran containing your polynucleotide. Okay, this has been already clinically studied for a very long period of time and has been used for really a long time already. Okay, this is FDA approved already, clinically proven safe, clinically proven like really effective. Okay, and I also had Rejuran on my face already. Same with me, Mao. Okay, so now we wanted the skin area. We mentioned a while ago the skin quality, skin tone, skin texture. That's already the basis of like becoming or looking attractive. Okay, so the beauty of the face is now based on the skin quality. That's why you see some people who are really taking good care of their skin. They look so beautiful because they have this radiant skin, glowing, luminous skin right now. And you look at their skin, it seems like no pores. Then you're gonna not
glass
see, exactly, glass skin. That's what we want to achieve. That glowing
vampire skin.
that glowing skin, bright skin, a luminous skin, radiant skin, okay, and healthy looking skin. So this one, we have a needle here. It's just like a gauge 33 with a 4mm length. And what I'm gonna do is like deposit it in the dermis layer, cheek areas. Then we're gonna do chin area, jawline area, and periphery of the face, as well as the forehead region. Okay, so a while ago we applied topical numbing cream already, so disinfect the entire face. Okay, so actually there are like techniques for delivering the Rejuran. Okay, so right now what I'm going to do is start with the needle technique, a needle method. Okay, and it's like a mesotherapy technique. In mesotherapy we have different kinds of methods. There's an Alapag technique, a point by point papule technique, wheel by wheel technique. Okay, so what I'm gonna do is the so-called papule technique. Okay, I'll be working on the cheek area, and this is just gauge 33 and bevel up. Okay, like in this area here, intradermal only, and you're delivering a certain papule already. Okay, how's that? Just fine, like a prick.
Ant bite.
Ant bite,
It's
okay?
Tolerable.
So you want to deliver it intradermally, so your angle should be like 30 degrees, and just delivering in the dermis layer. And you want the dermis to be healthy and restored. You want your fibroblast cells to be stimulated again. Okay, so you just develop this kind of papule effect, tiny wheels or tiny blebs. Okay, so the cheek area, we highlight this one like a makeup artist, right? You put on like highlighter on the, especially this part of the cheek area, the zygomatic area. You put the highlight there. So we just want to restore the luminosity of this cheek area. So multiple papule techniques here. So we're applying it here, and then we can go posterior to that. So I noticed with Mamao, you know, as time passes by, we get the so-called age spots, right? So actually there was a study presented that this kind of polynucleotide, they can inhibit the so-called melanogenesis pathway. So for those with concerns of dark spots, blemishes, melasma, or PIH, pigmentations, this is also a treatment that you can apply, because this is regenerative. This is repairing your skin tissue inside. Because with those with melasma, they have already the so-called injury in the dermis-epidermis junction. Like there's a disruption in the basement membrane between the epidermis and the dermis. So you can use your Rejuran to repair. Actually, we call it Rejuran Healer. It's healing the skin from within, and so it's working inside. Then you see the effect on the outside. So we're just doing multiple injection techniques. Okay? Okay, so I've done the needle technique, needle method. I'll shift to the so-called cannula method. Okay, for cannula, I'll be using a gauge 25. Okay, so it's normal to have like pinpoint bleeds. Okay, because we had a needle, we had piercing with needle. And our face is full of blood vessels. It's a hypervascularized face. That's why I only go to our trusted doctor. So with my jawline area, I'm just gonna do a cannula method. Okay, actually you can also like apply it in your nasolabial, in your under eye, in your temple, and this posterior aspect of the face. Okay, I'm just gonna deliver my product in this lower part of the face. So I'll make an entry point here, like a tiny prick there, tiny prick, and then just gonna deliver it with my cannula, gauge 25. Okay, so this is again a gauge 25 cannula. And the goal here is to deliver the product in the right layer, okay? We want it in the fibroblast layer. Your fibroblast cells are found in our dermis. You can place it in the dermis and subdermis, okay? So we want to be very superficial here. There you go. I am superficial, okay? So this is one technique that our doctors can actually apply. So this is like doing a fanning technique, okay? We want it also in your dermis, or you can even place it subdermis in your subcutaneous layer where you can still stimulate fibroblast cells. So again, we wanted to restore also skin hydration with our Rejuran and improve the skin quality. So this is already a regenerative molecule because aging is brought about by the so-called 3-letter Ds. First letter D is the skin degeneration. Sister Mau, degeneration of the skin or deterioration.
That's inevitable.
The first, yes. The second D is the so-called descent. That's why we do some thread lifting. The third D is the so-called deflation. You deflate, you have volume loss. That's why we do volume filler. So this one is treating the skin degeneration. So we want to restore your skin regeneration.
Wow.
It will activate your skin's natural regenerative power. There you go. That's good. So I'm just delivering it in this area, okay? And then you can go in the jawline. You can also use it in the neck. Actually, even like those with problem in the hand area, we have the so-called Rejuran HB. We can use in the hand areas. And even those with the so-called like acne scars, we also have Rejuran S for acne scars. And also for under eye, like your sunken under eye, we also have the so-called Rejuran eye. Okay. Plus, the Rejuran also have this skin care line. Actually, I use their Rejuran retinol, like a night cream. And I also use the Rejuran under eye morning and night. You know, you have to really take good care of your skin. It's part of the health, our totality of your health. Do you know that your skin is considered as your visual certificate of health? Meaning to say, di ba we get medical certificate? Like when doctors evaluate you, they can check your skin if you have like diseases, the color of the skin, the quality of the skin, if you're
so your condition shows visually already.
Visually skin. So there you go. So the skin is considered as our visual certificate of health. Okay. So I can still do actually from this side here, I can work on the nasolabial area there because I have a cannula that's long. It's, I think, a 50mm cannula, okay? You can use like a 38mm length cannula. This is a gauge 25, okay? So as much as possible, I want to go in the subcutaneous or dermis plane. Even the subdermis plane, it's fine. But you want to really activate your fibroblast tissues there. So I'm just going to be pushing and directing it there, okay? I'm almost done. So far, so good. So, there you go. We've done the Rejuran procedure, needle method, cannula method, plus the non-surgical nose enhancement. We'll show the result when CSA Medical Aesthetics returns. And we're back, so we'll show the result to Ma'am Maureen. Here's our mirror, Ma'am Mau.
Oh, wow.
So we did the non-surgical nose enhancement. We also used our Rejuran Healer for the entire face using the needle papule technique plus a cannula method to deliver that kind of polynucleotide in the dermis-subdermis layer to regenerate the skin tissue and give that healthy, younger skin. For an ageless skin, Ma'am Mau, right? So right now, it's
Yes.
just like a temporary like papule over the cheek area, the forehead area. What we did on the lower was the cannula. So we see some of those blebs. Then within the day, it's gonna become flat, okay? Some tiny erythema there. So it's just a day. Some of my patients, like even like few minutes or few hours, it's flattening already and the redness is gone already. So this is a Rejuran Healer. It's healing from within, especially those who already had photo damage, like sun exposure, or those who have this like PIH or post-inflammatory hyperpigmentation, or those with melasma, or those with concerns of large pores, or even those with fine lines or wrinkles or aging skin or dry skin and others blemishes, and even those with like acne scars. And we can use this kind of Rejuran Healer. Comment, Ma'am Mau.
Yes, look. Like I just popped pimples on my
It's just like having your facial treatment, okay?
In fairness, the nose not really that painful.
Right.
Here, there's a bit of pain. It's like ant bite pain. But I think that we didn't spray anymore, right?
Exactly, we didn't even use the pain.
That's why I
So
think I felt the pain a bit.
This is something tolerable actually. Well, we had two methods. We just demonstrated two methods, but I prefer the cannula method because the cannula, you just have like a single entry point for every side, and that's it. You deliver it in a fanning technique in the dermis subdermis layer. Because the papule technique, there are multiple needle injections, serial injections of your needles. That's why that's the one that's really with some discomfort. But somehow she was able to tolerate. We applied numbing cream EMLA. Or we can also combine the pain freeze or the cryogenic spray to also make it not painful. And the nose, we actually use only the PDO threads, no filler. Okay, so with the nose, I use like 8 of those long PDO threads, 50mm length of the cannula. And I did combine with those 38mm length of the cannula on the nose bridge. Then also on the tip columella, I used 4 pieces of the PDO threads, inserted it up to the anterior nasal spine. So we wanted to also improve the height of the radix, the columella projection there, the nasal tip projection there, as well as the nasolabial angle, the nasofrontal angle, and also the canthal width, intercanthal width. We wanted to improve that. And it's still Mama Win, okay?
Yeah.
Actually, I'll still do a so-called Aller tox to reduce the width of the alars. And I noticed she has thick fatty tissues on the nose tip and the alars. We also do the nose meso injections to dissolve the fat tissues to reduce it. It's for nose slimming as well. So we do combination threads plus nose lipolytic solution injections and Aller tox to still make that slimmer, narrower nose. Still Ma'am Maureen, okay?
Yes.
So gradually, I'm already seeing the papules, the red papules there. It's starting to fade, okay? So little by little, it's gonna go away. But you'll see the effect of this one like in a week or two. There's a glowing and radiance of the skin. Beautiful. Usually, we recommend Rejuran Healer like a 3 to 4 sessions, 2 weeks interval to achieve that radiant, younger skin, okay? And regeneration of the skin tissue inside. So for an ageless skin, especially those who are like, they always put on makeup, okay, or they're always under the sun, and they have this skin damage already, photo damage already, some skin injury there, and then also the deterioration of all those collagen, elastin, glycosaminoglycans. When we age, there's a reduction of all those production of the fibrous proteins in the dermis. It's because when we age, you activate the so-called proteolytic enzymes that degrade all the collagen and elastin. From also like unhealthy lifestyle.
Enzyme?
Yeah. We call them matrix metalloproteinases. They're activated when we're aging. So more of the breaking down of collagen, less of the production. So what Rejuran will do is increase the production of collagen and less of the breaking down of the collagen.
So that's the science behind.
That is the science behind our polynucleotides. Any message, Ma'am Maureen, and invitation?
Happy. Look at my nose. It's natural. So I don't want an OA nose.
Yeah.
See? I asked Dr. Wrights, it has to be suited for my features.
Exactly.
Thank you, Dr.
Thank you, Ma'am Mau. And we'll still follow her up, okay, in the future episodes, okay? If you have any questions, you may email us at csaskinclinic@yahoo.com. Our FB page, CSA Medical Aesthetics. Instagram, CSA Medical Aesthetics. Our clinic is located here at the Infinity Shop, Pulong Maragul, Angeles City. Contact number 0933-860-9193 or 0917-504-4268. Ma'am Mau, your salon.
Yes, Hair at Heart Salon and Makeup.
Okay, and please do watch our other videos and subscribe. And thanks to all those who have subscribed already. So God bless you all. When it comes to natural beauty, you can trust the CSA Medical Aesthetics.